Now to the pandemic, where new cases in both states are going down. In Missouri, the 7-day rolling average is down to 831. In Kansas, the state has added 1,200 since Wednesday. In Kansas, the monthly positivity rate is down to 5.4%. In Missouri, the positivity rate is down to 7.2%. The Centers for Disease Control says America's schools can reopen despite the pandemic, but they have to manage things very carefully. KMBC 9's Michael Mahoney breaks it all down.
Based on their research, the CDC does not think that schools are a center of COVID-19 activity. To keep it that way, they think the schools must observe the basics: hand washing, social distancing, universal masking. In a conference call, Dr. Rochelle Walensky says the CDC is not ordering schools to reopen. The guidelines do not include a call from teacher groups to have them get vaccinated, but educators and staff say it should be a priority.
The school staff hasn't been a priority in Missouri for getting the vaccine. We've got a lot of concerned staff about going back. They do want the vaccine.
4 out of 5 Missouri schools are already open in some fashion. The CDC plan breaks school reopening down to 4 color codes. Blues and yellows are schools with low community spread, low positivity, and few new cases. They can go back in person. Schools in the moderate community spread range are orange, hybrid school, and reduced classes. Schools in the red zone, and that's a lot of them, can have some school classwork if they regularly test their teachers and students. If they don't, those red schools remain in distance learning.
There's no easy solution, and yes, it can be done, but it is challenging to do well and consistently. And quite honestly, that's what everybody deserves from us.
The CDC says these are guidelines, not orders, on how to reopen schools. Michael Mahoney, KMBC 9 News.
The recommendations say teachers, staff, and students should be tested for the virus every week. The Douglas County Health Department is recommending school districts go to in-person learning full-time now. The county is now in the local green tier for the first time since October. It comes after the area's 14-day positivity rate dropped to 2.9%. Also, the number of active cases continues to drop. Starting today, you can make an appointment to get a coronavirus vaccine at Walmart and Sam's Club stores. Make an appointment online on the company's websites. But first, make sure you're eligible for the shot in your state. Price Chopper pharmacies will eventually get vaccines from the federal government, along with Walgreens and CVS locations. It's estimated 1 in 10 people in the U.S. have gotten their first dose of the coronavirus vaccine. Boosters are next. But what happens after that? Doctors at the University of Kansas Health System say no one has the answer yet, but that it's likely you will need a booster every year.
Hopefully it will just be a one-shot booster, not a 2-dose series booster. But I think we do, because we always know that the virus, and we've seen this playing out right now, the virus is probably 1 or 2 steps ahead of us. So we do need to keep on top of it.
Dr. Hawkinson says he agrees with Dr. Fauci that a yearly booster is the best way to decrease the spread of new variants of COVID, as well as the variants we're already seeing. The University of Kansas Health System is boosting its minimum wage to $15 an hour. That move comes as the health system battles financial and operational challenges that were brought on by the pandemic. The health system has not laid off or furloughed any staffers during the pandemic. The change took effect on Monday, and it will be reflected in paychecks starting March 5th.